What's the word, everybody? It's your boy Melly Mel, aka Tress, alongside Fab and Blaze, and this is WaveStarterz Podcast Episode 7. Today we're joined by a special guest, Dr. Stephenson. She specializes in child psychology, which includes but is not limited to behavioral modification, trauma, anxiety, and diagnostic testing. Today we're mainly discussing children's mental health coping through the pandemic, as well as ways of dealing with police brutality. There will be a lot to discuss, but before we do, please subscribe to these platforms: Anchor, Breaker, Radio Republic, Google Podcasts, and Spotify. Also follow us on Instagram at WaveStarterz Podcast, on YouTube, WaveStarterz Podcast, and on Facebook, WaveStarterz 516. Dr. Stephenson, thank you for joining us today.
Thank you.
Thank you. Thank you.
Yes, guys. Good afternoon, fellas. To all your viewers and your listeners, I am pleased to be here, and I'm graciously accept this honor for this opportunity in addressing your questions on the controversial topics regarding the novel coronavirus pandemic, racism, and police brutality from a psychological aspect. Racism and police brutality is a common topic of discussion in the world today, as you know. It is intriguing that the conversation of racism and police brutality is also taking place globally. Nevertheless, I will welcome your questions and discussions on the issues of novel coronavirus, racism, police brutality, particularly from the perspective of the effects of racism, police brutality on our people, particularly our young children. So let me hear it.
All right, I have a question I want to ask. How can parents cope with it, not only during the pandemic, but just in general, and their children as well? How can they how do they deal with it, like the stress and the anxiety, the depression? What are the steps they could take to, to like ease their minds a little bit?
Okay, first of all, as I say to every parent that I receive calls during this time, is to be honest. That's the first and utmost thing, to be honest. Tell your children the truth. And the truth is, it's not all policemen are bad. And as for the corona, it will have an end, or it will get normalized somewhere or the other. All right? So which would you like the discussion first, since we are addressing two topics, the coronavirus and police brutality?
Do the coronavirus first. We'll do that first.
Okay, well, I did receive a lot of calls. We had a lot of sessions during this time with the coronavirus where kids were very stressed. They were under a lot of stress from daycare right on up to junior high and high school, where they feel imprisoned, locked in. Their space was invaded by being inside the home and so forth. So we had a lot of calls from parents how to deal with it. Kids were not able to get on outside and so forth, or a lot of eating, a lot of nagging. Can I have this? Can I have that?
Yeah.
So as I said, you have to find time for them. Children does not take stress the way an adult, on an adult level, whereas you have to exercise more patient, way more patient than the normal. All right. As for the little ones, they need it more. For an older child, teenager to pre-adult, it is easier to sit with your child and be able to say, okay, you can look at the news. You could see what is going on. This is what is happening. You can't hide it from them, because it's not something where it is your fault as the parent or the government. But this is rules that we have to abide by. We have to wear the mask. We have to be inside. We have to wash hands. We got to talk on the phone to your friends. You can't go outside. You can't have them coming over, and you cannot go over. And the little ones, you got to be able to make healthy snacks, because they're constant thirsty and want a snack and I'm hungry. Pretty much the usual that they will be going through from day to day, from Monday to Friday in school. Or find some time during the day to take a little walk with them in your community. Wear the mask, let them see other people doing the same thing that you're explaining or the TV is explaining.
So they know it's not just them that's
right.
Like,
but as I said, the bottom line is to be honest.
Right.
That's the bottom line. You can't hide it from them because they're going to figure it out anyway, and it's all over the news, even on their phone.
Mm-hmm.
Okay. So what about for adults? What do we do as the parent for our own selves? What do we, like, you know, the stress of work or coming home and then you have the child there that's nagging for attention, you know, and even going to work, like even for essential workers, how do we deal with it?
You need time for yourself. You need to find that little time where you get into a room somewhere and take that little 5-minute
breath.
Maybe when the kids are sleeping or they're doing their work, you could go and meditate real fast.
Exactly. You got to find that little time, whether it's
in 5 minutes. 5 minutes.
And believe you me, a 5-minute helps a lot. It helps a lot.
Okay.
Yes.
Definitely.
Okay, cool.
So I have a question myself about mental illness. I wanted to know, is medication helpful for mental illness? And as a psychologist, you recommend it?
Okay. Well, first of all, let me tell you, as a psychologist, the aspect of psychologist is not medication.
Yeah, psychiatrist, sorry. Psychiatrist.
Yeah, the psychiatrist is, that's okay. It's not just you. It's a everyday question. Whereas, you know, I don't want to see the psychologist. I don't want to be on medication and so forth. But as a psychologist, it's from therapy into psychology, diagnostic testing, and then you get refer, if it's necessary, onto the psychiatrist.
Okay.
So your question was if I would recommend it.
Yes.
In my field, I'm 99.9% it's therapy.
Okay.
I monitor the medication after the psychiatrist evaluate the child or the adult and deems necessary that you need to be on medication for stimulation or behavioral modification. You need the medication, but you need to follow up with your psychologist, which comes back here.
Yes.
And I monitor the child weekly or bi-weekly or twice a week to make sure that medication is adhered to, and at the same time, psychotherapy treatment.
Is it safe for children to take medication?
You really can't say that if it's safe or not safe, because on a whole, medication, you know, it all comes with their different
side effects, right?
Side effects that they comes with, and some of the side effects are generalized, as well as some of them can go on for a long time. So, right, so you pretty much have to stay in touch with your doctor, you know, to see what side effects. You have to report everything. But to starters, if you come and see the psychologist, as I said, if you see the signs that this is my child or this is my wife or my husband, the job is too stressful, the relationship have some tension, you try to seek help through the psychologist before I would do a recommendation that this is far gone, you need to see the psychiatrist.
Okay.
And it has to be really far gone before I would do a referral to the psychiatrist. Far gone as an example of aggressive behavior. There's a tendency of aggressive or addictive behavior where they can no longer have control. Then let the psychiatrist evaluate you, and if he or she said that medication is not necessary or deemed fit, you can come back and receive weekly therapy to work through your situation, where I would adhere coping skills in weekly, bi-weekly, or twice a week session.
So pretty much like psychiatry is like a last resort type of thing.
Right, exactly.
Okay.
So Dr. Stephenson, you know, we never been through nothing like this before, where our kids are home and we have to actually be there around them 24/7, and they have a lot of distractions around them as far as TV and video games and different things. You might think that they're doing their work and they have these tablets, but they switch over to a video game or something, just surfing through the internet. How do we keep our kids through this pandemic focused on their academics and set aside the distractions?
Well, on a whole, everyone is going through a lot of stress at this time. So is the parents, even the teachers that are at home, because at home, in the school setting, it's like a teacher can sit there and monitor 28 kids at the same time. But can you picture for a second a teacher being at home monitoring her family and has to be on the computer to monitor all 28 kids to make sure everyone logged in, signed in. It's even more difficult for them to do so. So the parents can help a bit to say, okay, step over to the Zoom or whichever situation they got that was given to them, whether it's through books or that was given at the beginning of the pandemic, stay home, or through the computer. Make sure that they are logged on, and every 5-10 minutes you go take a look. And I also recommend that after the session is complete, you put together a package for them. I had given advice to almost every parent that called. School doesn't end at the session with the teacher. She cannot stay on the computer from 8 in the morning until 2:30. So what you do is you prepare a package for them, and put it aside to say, could you complete this? Can you read 2 chapters in this book for the teenagers? And then mommy or daddy, auntie, whoever is monitoring will come and, check to see whatever has done so that we can communicate as well with the teachers.
Mm-hmm. So kind of keep them like on a school schedule.
Right, intellectually going.
Okay.
Always until that 2:30 gap. And you keep your children the same way as they were in school. No moving about or talking on the phone. It's a school setting, because when school reopen, this is not forever. Sometime we're gonna have to get back out there, and you can't be doing these things. So this is what we call adaptive behavior, where they will adapt these patterns too quickly. I also recommend that you get your child into bed the usual time that he or she would have been in school, a school day. Why is it that they're going to bed at 11, 12 o'clock at night, tiring you and frustrating themselves? So the pattern still stays at 7 or 8 o'clock, whatever is your cutoff time, you still go to school. This is not a Friday night. This is not a holiday. Right. You're in school. So keep guidelines and pattern stringent.
That makes sense. Very interesting.
Yes, it's very helpful.
Yeah, Dr. Stephenson, well, this is not really for COVID, but it has to do with the mental health.
Okay.
But let's say, because this is traumatic, so it kind of ties in the same way. How do we get ourselves out of what we've been through? Like, because this is traumatic for everybody, so everybody takes it differently and feel differently about it. So how do we take ourselves away from these thoughts and being anxious again, like anxiety, like going to work, what if it happens? You're on the train, what if it happens? You bump into somebody, how do you deal with that?
Yes, at this time now, I have a lot of anxiety patients, so many patients that are suffering after, even though the corona is still much in effect. It's just not as rampant as it was a couple months ago, 2 months ago. So what happened now, I must say too, this is a good question, which I got all the time. How do we cope now? How do we transition back to okay, we're freaking out, we can't go outside, we have to wash hands every 5 minutes now, to transition back to a little bit of normalcy. Yeah. So what you do is, which is a good technique for this, you talk. You talk about it. You gather with your friends, whether like this platform right here, 3-4 friends gather on the phone and talk. How did you do through this? You send pictures. This is what I did. This is what was going on. It's going to be a process. The transition is not going to be just to hop back to, as pretty much a lot of people doing now, get back outside. We're just going to live freely. No, this is going to take a lot out of you, but you have to take it step by step. Step by step, and talk a lot. Talk about the effects that it have on you. Oh, I'm still scared. I can't go outside. It's bothering me that I can't see my friends. We can't get a drink. You got to find other options to say, okay, we're gonna do a 6 feet distance. We're gonna come out, but we're gonna meet here, and we're gonna spread our blankets. We just got to get out and talk and laugh, even if it's a movie. Everyone could be watching a movie at the same time and then have a major discussion thereafter.
That's true.
Notice a lot of people are out and they're acting as if nothing never happened.
You will have some, it's not, it's not everyone that will adhere to the rules. You know, this is why the government had to put in place that if you don't adhere to the rules, we're going to give you tickets. You know, they got to do something, because not everyone will understand that we just can't hack back into reality. It will probably take quite some time, you know, another 4, 5, 10 years before we see some real normalcy. People will be walking around with masks for quite a while. As well as, like you said, some people will completely forget to wash hands.
Yeah.
You know, wash hand is a big thing now, and sanitizing. But within another couple months, it's like you forgot.
Right.
You know,
People are touching their face where you're not supposed to touch
Right.
your face. Your hands are
Right.
dirty because it's just a known habit, you know.
exactly.
For Roman's question, I want to add input. Do you think with the anxiety, you think the media plays a part in that as well, as far as like the news?
Well, of course. This is why I said to parents a lot, try to let them see just what is important. You know, the kids don't need to be seeing bodies getting put into trucks and, you know, a policeman manhandling someone. This is something that can come from you, the parent.
Okay.
So the social media, the television, the media, all of that stuff, you as the parent has to know when enough is enough.
Okay.
You know, as for yourself as an adult, sitting there all day watching ABC, NBC, CNN, it's not healthy for
Not
you.
good for the mental.
You know, it's not good for anyone seeing the news repeatedly itself going on. You get what you need to get, and this is what I need to do. This is what we need to do for our family or our friends when we go back to work, and you take it from there.
Okay.
It's not healthy.
Yeah, I have a question about actually about the police. With like police brutality. As a child psychologist, what's an appropriate age for parents to have that conversation about interaction with the police? It's a two-part question actually, and my second question to that as well is, how would that conversation go with an 8-year-old versus a 13-year-old?
Okay. Your first part of your question is at what age? From the moment your child can understand that this is a police officer, that's when the conversation starts.
Okay.
From the moment your child can understand that this is what a police officer do, this is when I take you to the doctor, you got to go get your medicine, you got to get your shots, they need to know. So in other words, you start taking your child, let's say at 2 years old, to see the doctor to get their shots. You explain why this is the doctor and what the doctor has to do, right?
Mm-hmm.
So it's the same versus the police. This is the policeman, this is what they do. There's no need to feed a child below 8 that a policeman is going to beat you, a policeman is going to abuse you, choke you. No, because you need to let them understand if something happened, this is where you go. If something happens to mommy at home, you call 911. The police is going to come. So you cannot instill fear in them because children are sponge. Okay? So at that age, they don't need to understand that, like I said, from 8 down to 2 years old. Mm-hmm. You start getting into what can happen just between the 9 and 10 going on up. You start explaining that, listen, if you be disrespectful, this is what the policeman can do. Because a child is at a better understanding. They're even in a different intellectual grade to understand that the policeman can do this. They're going to put a cuff on you. They're going to put you in the truck. They're going to take you to jail. This is what's going to happen. Mommy won't be able to see you. Daddy can't come if you're over 18. You're going to be on your own. So you got to be obedient. You got to do this. So it starts from home. Right. I know I get a lot of questions, whereas, yeah, but you do all that and the police, they still do this to you. You understand? So at the same time, it's just like you explain to them, you're home. And you said, but mommy, I did my work. I did what I'm supposed to do, and you still punish me. So you see where I'm saying that it really is an impact from home where it starts, because they see that happens at home. It don't matter what I do. You promise I would be able to go outside or watch a show for a certain amount of time, you change your mind. You go outside, it's the same thing. So if you be consistent with your children at home, you let it start from home. That is, if you promise you're going to come, make sure you come, so that they know that what you're saying about the policemen on the outside is not going to be a negative impact. So when it happens, as the policemen still arrest them, you know that, okay, I got your back. We, the parents, we're going to come. We're going to have to find attorneys. We're going to have to do what we got to do to get you out of certain situation. But it have to be at home where the truth is being told. Did you take it? Did you not take it? So we know. You know, don't cover for your children.
Okay. Dr. Stephenson, has recent police brutality cases changed your perspective on law enforcement as a whole? And if so, can you see any improvements being made to solve this problem?
Well, of recent, as you said, it really hasn't changed because psychologically, it has always been there. It's not just the George Floyd incident. It's not just the Marbury incident. This has been going way, way back, that this has been happening. And as you asked to change my perspective, I've been begging, I've been writing that one of the things that can be done, we all got to come to the table, including our senators, our governors, mayors, psychologists. We all need to come together and form some kind of pathway for these officers. One, I truly believe that each and every one of them need to be psychologically tested once a year. I would say you could start with once a year. It depends on whatever it is that they've been write up for, because at the end of the day, they're human beings, men and women, just like us.
Yeah,
and if we can have problems as parents, you know, as we can have problems as parents, and the teachers and on everyone in the work places, all professionals, at some point in time, as mental health has to be taken into consideration, that it's a dire need in every workforce, So if these officers are, the government can able to reassess them even psychologically once a year. As I said, you could start once a year to find out what is going on. Is it the financial salary? Is it a domestic situation at home? Is it a child with behavioral modification that needs to be addressed? Whatever it is, maybe they have some long-term illness. They just lost a parent or a child. Their wife can't have a child. Whatever it is, they go out into the field with that same situation. And sad to say that our people are the ones that get the most affected by their problems that they have, because there is just no reason for anyone to suffer such cruelty. You know, everything has its step. They do the arrest, the judge take over. Let the judge pass the rules, you know, and go from there. You do what you got to do. You do your part, and then I'm going to send you over here.
Interesting. Thank you for that. For your perspective on it. I think it's gonna open the eyes and the minds for a lot of
they need to be able to release stress. They need to be able to get that attention.
They're taking those home problems, like you said, because we're all humans, we all go through stuff.
Yes.
It's like they're taking their home problems and their personal problems, bringing it to work. And you know, our community, our color, our skin tone is affected the most by those situations. It's a big deal.
And another thing too, I do have some officers that receive therapy, and it's not really at home. Believe it or not, some of it, racism and bias is even in the workplace, and they're dealing with that too. So here they are, they leave a peaceful home and come to work, and you're dealing with a coworker that is constant harassment. You have to go in your mobile out in the street, and you have someone, your supervisor or your director, that is on your case constantly. So then it's in the workplace, it's at home, you're dealing with it in everywhere you go. So they have to release it somewhere. And unfortunately, it got released into the wrong, you know, the wrong venue, whereas someone end up die.
Yeah, we suffer from what they feeling.
Right.
We get the excuse my French, the shitty end of the stick. Say. Yeah.
With that, I had another question I want to ask. Usually when, patients, or I'll say like schizophrenics, when they're off their meds, sometimes they'll go crazy out in the street or whatever. How can a cop settle down the situation? Like how, because
Like
they're not
de-escalate.
comprehending. Yeah, they escalated. They don't really comprehend what's going on.
They might resist arrest or something like
that.
No, this is a very important question, which brings me back to what Mr. Usher said. His question was the coping skills of the officers, where my response is training, psychological training. If they can receive this from their superiors or the government, or they just go on their own to receive these classes, and there's something for everything.
So it should be mandatory that they take psychological.
It should be mandatory that if you're in this situation where you got called in and we're dealing with a mental patient that is swinging a knife in the home, there's no reason for that patient to be killed with your gun.
Mm-hmm. True.
Even if you have to call it, okay, well, you call child services if a child is acting out at home, right? So why can't you call a psychologist? We need to have a psychologist to come on board with the police and deal with the situation where we would know what to do with a schizophrenic patient that don't want to put a weapon down, or is screaming off the top of his head, or trying to jump over a building that you're trying to apprehend. There is techniques, but if a police officer is not trained in that field and only trained to hold criminals, this is what you're going to get. All they see is criminals. They are called out. Someone is out of order. It's a criminal.
Right.
Yeah.
They're not trained.
That's true. No.
So that's on the list of things to better. Besides defunding the police, we could start giving them mental like therapy and stuff like that. Like every write up, then they could get one every write up if they
therapy
get
therapy and retraining.
Right.
Exactly. Training. They need better training, especially in mental health field. It's not everyone out there that has the same situation. Everyone is not a criminal. You has to know how to deal with it. Everyone that walks in through my office is not the same situation.
So, but some cops go out in the field with an agenda. So that's why it is.
Well, that is true.
But where does the agenda stem from?
That's why
psychologically. That's how the psychologist would figure it out. That it can be from childhood. This is what I said earlier, that you could leave from a peaceful home. No issues with your children, your wife, you're financially stable. Everything at home is fine. You have a wonderful home, but you step out, you have to deal with coworkers that are unstable. They have their own issue, but you got to deal with this coworker that, keep pressing your buttons. And one day you got pushed over the edge, and it's not going to be him, but someone on the outside.
Or even the public that they're dealing with, right? It could be something that they're about to apprehend. They, try to push the cops' buttons to,
well, as you've seen, even in these protests, a lot of people are going in cops' faces and,
throwing stuff at them.
Because they're angry. They're angry.
Definitely.
Mm-hmm.
But it's not the answer. I mean, I understand the anger.
They're angry, but the cops still got to do their job. So,
yeah, some of them do the job, but I just feel like sometimes it's like we could walk down the street and they'll say we match the description. That's the first thing they say all the time. I don't get it.
Happened to me before.
There's too many videos of matching description.
We don't all look alike.
Why? Because of this, we all look alike, right?
Yeah.
Right. As for that, I do have a lot of teenagers of color, and the advice to them is always, try to be appropriate, try to be respectful at all times. when you get pulled over, we already know that it's a stigma of Black men get pulled over more by the cops or get pointed out that you familiar someone, or as you said, you fit the description. That's the line. But you remain calm. You remain as respectful. You don't give them a reason, you know, even though sometimes they don't need a reason. You see many videos where, you know, they're very calm and it still happens. But once again, if the psychological services was in place for them, I wouldn't say that it still wouldn't happen, but it would be at a more minimal. Yes.
Definitely. Okay. Dr. Stephenson, thank you for blessing us with your presence and your knowledge today.
Absolutely.
Definitely.
We need it, and the world needs it as well.
Yes.
For people who want to get some of your sessions or want to find out how to find you and speak to you, how could they do so?
Okay, well, you can reach the office through wecarefam@gmail.com and send an email because we are not doing any services right now in person. All the services are done online or via telephone. Okay. Or they can also call at 718-487-4412 or 487-3919 or 516-287-0008.
So you guys have no excuses. Multiple ways you can reach Dr. Stephenson.
Yeah,
I will post all of the information in the YouTube link. Dr. Stephenson, thank you for stopping by.
Thank you very much.
Thank you guys too for having me. It was my pleasure to be able to share with my people a little bit of psychological knowledge. And as I said, at any time, feel free to invite me. I will be back.
Definitely. Thank you.
Thank you.
You're welcome.